The massive influx of migrants arriving in Denver is pushing that health system to its breaking point. The Denver healthcare system is now saying that it has provided more than $130 million of medical care that it still has not received payment for, with thousands of migrants contributing to that bill. Joining us now with an update is Federico, Chief Government and Community Affairs Officer for Denver Health. Sir, thank you very much for joining us. First off, what exactly is happening with the healthcare in that hospital? Can somebody who's showing up right now that needs care get it?
Yeah, thank you for having us, Sandra. So Denver Health is very proud of its 160-year mission of providing health care to people in Denver, regardless of their ability to pay. Just to correct one fact, last year we did provide $130 million of uncompensated care, and a small portion of that is related to the recent arrival of many migrants, but the baseline for our hospital was at $130 million prior to the arrival of this population.
Okay, that would be an important clarification. So you're saying that all these migrants that are showing up at the hospital are not racking up big bills?
No, they absolutely are contributing to that. We estimate that we've seen about 8,000 of these newly arrived migrants in our hospital system, from emergency rooms to primary care to dental clinics, and of course, the lack of a federal response to the healthcare needs of this population results in their inability to pay for the majority of this care. So it has contributed to our financial distress.
To be clear, what do you think the federal government is responsible for? How should it be stepping in here?
Well, I think we need to provide basic needs to these populations. They are coming to our hospital as patients with basic healthcare needs such as respiratory illness, GI illnesses. Some of them have baseline chronic illnesses such as asthma and diabetes. We're seeing severe dental disease in the population. Some of them have acute illnesses as a result of their arduous journey, living in unsanitary conditions, drinking poor drinking water. And so we're doing the best we can from a clinical standpoint to take care of them. But we really need a system in place to help pay for that medical care, to make sure that these patients get the needed care, get the needed medication, get the needed follow-up. And the lack of a structured system to pay for that is making it extremely difficult for our clinical teams.
What do you say to some who might say that structured system should be our secured borders? They're coming in because they can, and they're coming in, and Texas has been inundated. Their resources are dried up. Their hospitals are overflowing. Their cities are paying a huge economic price. And so now they're going to other cities. And now this is falling in the lap of Denver. And as far as we are being told, your healthcare system is inundated.
Yeah, a huge shout out to our mayor and our federal delegation for calling on the federal government to support this population as they await additional policies that will call for their long-term viability in this country. But I do think it's important that we need to provide social infrastructure for them, places to stay, food for them to eat, and healthcare. Healthcare needs to be a key component to the response of this population.
And obviously, and that is your job, and we understand that. There's a huge economic concern. There's only so much that our system will be able to bear. And many others will have to pay for that eventually. And that is a question: where does that money come from? Your mayor, Johnston, who you just referenced, he said that there's a big problem with the lack of work permits for these migrants in what he called was a broken federal system. Listen here.
It is unsustainable in the current structure when we have 30 or 40,000 people arriving without work authorization, without federal support. It is going to be a huge strain on cities. If you send us someone to Denver who has to wait 6 years for a court hearing and they can't work in the meantime, we're going to need almost endless amounts of federal support. I don't think that's what we want or the federal government wants.
So it feels like what he's pointing to is the process here. When you've got all these tens of thousands of people arriving without work authorization, without federal support, this is a huge strain on the local level of so many of these cities who have said, we welcome everyone.
Yeah, we're proud to stand with the mayor in response to this humanitarian crisis, and we absolutely need additional funding to provide a sustainable infrastructure to support their path forward. I agree. I think allowing them to work is absolutely a part of the next steps that it's going to take to provide the funding. But we also need federal support in the meantime, most especially around the healthcare costs.
Yeah.
You know, our staff are being asked to staff up, see extra patients, and then, you know, the moral strife that comes with discharging a patient, not knowing if they're going to have the money they need to fill that needed prescription, find transportation to a follow-up care, come back for additional care. It's extremely strenuous on our staff, and I really feel for them.
Do you have any doctors who are saying they just can't do it anymore, that it's just too much? I mean, is there staff that are saying that they're leaving?
No, our staff are very proud to fulfill the mission of Denver Health, to provide care to everyone, regardless of their ability to pay. Very much responding to the humanitarian crisis of these patients.
We understand.
But we're going to need additional support to do it, and to do it well.
And have you had to turn away any patients?
No, so we'll always see patients, most especially through the emergency department, which is where we're seeing the vast majority of these patients currently.
Oh, okay. So because the headline everywhere right now is that you've had to turn away patients. Is that not the case?
No, we always see patients through the emergency department, regardless of their ability. Now, our ability to see them in follow-up is extremely limited based on physical capacity and the lack of resources to do so.
Understood. We thank you for your time, sir. You have a huge task at hand. Appreciate your time. Thank you very much.
Thank you for covering the story. I appreciate you.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.